Welcome to the Huron Valley Now podcast, where we share inspiring stories of business, life, and giving back. Today we're here with Britt Golden, and she is the owner of Many Paths Nutrition. Britt, I'm curious. You got the name Many Paths Nutrition. What's that all about? Is there any meaning to it, or did it just sound cool?
Yes, so I do think it sounds cool, thank you. But there is definitely meaning behind it. I am of the opinion, and I think a lot of functional practitioners are as well, that the way that a person is going to get to their healing journey, destination, however you want to look at it, is not going to be the same as somebody else. And so that's where that came from, is basically there's many paths to health. And I've had some people, same type of autoimmune disease or issues that they have, and I'll treat them completely differently, even though they have the same problems and symptoms going on, just because their body responds differently to things.
I love that perspective.
Yeah.
Because, even if you're going to the same destination, your path's going to look so much different.
Yeah.
You're going to take different steps.
Yes, they have a different background, they have a different toxic burden, they have a different environment. All the things are factors in their healing process.
And building off of that, you take a holistic approach. Can you explain to people what that means? Maybe as opposed to focusing on one area?
Yeah. So every client at every appointment, I'm looking at their sleep. I'm talking with them about their stress. I'm talking with them. Yes, diet is a majority of the conversation, of course, because we need to be filling our body with good food. We're looking at, because I can have somebody doing it completely right in the kitchen and completely right physically speaking, like movement, they're getting their fitness in, but maybe they have a chronic stress at work and or a toxic relationship or something of the like. That stress is going to be the thing that's holding us back from healing. So I have to examine all areas of what's going on with this person to truly get to a place of homeostasis, if you will.
That's so important. And what kind of conditions do you help people with?
Yeah, so I have people reach out to me. Weight loss is a big one. I mean, everybody thinks nutritionist when they think weight loss, and so I do get a lot of inquiries for that. But honestly, even the weight loss clients, there's usually more going on there than just the need to drop some pounds. There's fatigue, there's issues with sleep, there's issues with stress, there's toxic burden, there's a lot of things. But typically, autoimmune conditions, a lot of people with autoimmune conditions will reach out, so fibromyalgia, MS, a lot of thyroid conditions, Hashimoto's, things like that their body is just in a chronic state of inflammation. And we have to bring that down with diet, with lifestyle. It's so important to, like I said, focus on all those different areas of holistic care. And then I failed to mention this when we talked the first time, I think, but I also am certified in postpartum nutrition as well. And that became a big thing for me after I went through 2 pregnancies. And so when you have these pregnancies, you're seeing your physician appointment after appointment after appointment, especially near the end. It's like bam, 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 bam. You're seeing them every week almost. And then you have the baby and goodbye and good luck. And then we see you 6 weeks later, you sign a little form, you're exhausted, and you're sent on your way. And there's just not enough care for the postpartum mom. And so that became a huge passion of mine. And so I have a program designated for parents or moms who have just delivered, and basically to help their body get nourishment and hopefully avoid things like postpartum depression and postpartum anxiety, things like that, help with lactation and things. So very geared towards that.
That's so cool.
Yeah.
And I help people a little bit with their diet as people are coming in for chiro care. And the game really changes during pregnancy and postpartum.
Yes.
It's not just your eat normal.
Right. And it's tough. I mean, even in that first trimester with pregnancy, when I'm working with pregnant women, it's like you're doing your best, I mean, typically it's saltines for a lot of women if they're having, a lot of nausea and stuff. Even myself, I was like, I'm going to be I'm going to eat so many salads when I have my babies, it's going to be great. And yeah, that didn't happen. You're
Right out
just
the window.
completely, your taste buds are like, yeah, ew, no, we're not doing that. You don't know what you don't know. So it also helped me become empathetic to that too. Because before that, when I would work with pregnant women, I'm like, what's wrong with these people? Just eat the salad. Like, just eat it. It's fine. But yeah, once you go through it and you experience it, you realize, yeah, that's not exactly how it goes. And so there's some empathy within that and tools and resources to navigate. So that's good.
Yes. And what does it kind of look like when somebody starts working with you? What is their experience like?
Yeah, that's a good question. So it all depends on their goals and how that aligns with my programs. I like to work within a program because there's accountability within that. And rather than kind of just like having a one-off visit, here and there, and then there's not a lot of follow through. I've tried it that way before and it doesn't usually work out. Most people need to have like those follow-ups and that accountability, which is good. So I have a couple different options that I work with patients. There's a 4-month program and a 6-month program. And so it's just, 2 months difference, same, kind of thing. It just depends if they have, maybe bigger weight loss goals or they're like very chronically inflamed, whereas like the 4-month would be good for like a tune-up or somebody who's like, I really eat very well to begin with. I still can't, drop these 5-10 pounds, or I have these digestive issues going on, or skin, whatever. So that's like more geared towards that. Whereas the 6-month program is like, okay, we have a lot of things we need to accomplish. But basically, we start off with an intake and the visit's 2 hours. And so in that time frame, I'm going over a great deal of paperwork that they filled out for me, like a good history. It's it's complex, and so I'm looking at background. I'm looking at their environment, their stress levels, a diet log, things like that. I do a detox test on them. It's just a written questionnaire, and I review all those things, in that first appointment, and just kind of go, okay, here's all the red flags that I see. These are the things that we need to prioritize, with your healing. And that's where it's sort of ironic that sometimes when people come in for weight loss, I'm like, let's put a pin in that, because your paperwork showed me all of this. And that's like, you got a lot of inflammation. So while we're working on that, the weight loss will come, but anyway, so we do that for that first appointment. And then I meet with them every month. Beyond that, some monthly visits, and we're following up, and like I said, checking in on sleep, stress, how the menu's going, some customized supplements and how they're taking those and how their body's responding. Are they still needed? That kind of a thing. So movement, that's super important for me. Sometimes people are too painful to have that introduced right away. And it's got to be something that comes in when some of the inflammation goes down. So, but yeah, that's about it in a nutshell.
That's really thorough.
Yeah.
And so you go really thorough during the exam, and then you nurture them along the way. I bet it's really rewarding when you get some amazing outcomes.
It's so cool.
Do you have any that stand out?
So I just had, I think I told you about this when we chatted, but I had a woman who, she hadn't been able to put her wedding ring on for 6 years. And after working with me for 6 months, she was able to wear it again on her finger. And she was like, this is so awesome. Like, I'm so excited. And I actually said, I'm like, can you send me a picture of your hand so I can use that as like a testimonial? And yeah, so that was so rewarding. But, I've had other people that they're just like, I can't believe I can go off of this medication, or like they never thought they were going to get off Prilosec. They never thought they would be able to live without their acid reflux medication. And I'm, we're a month or 2 into the program and they're like, I don't really need this anymore. I'm like, yeah, your diet was really the main cause of a lot of those struggles that you were having with that. So and then that's great because they can identify and they're like, I actually am more in control of this than I thought I was, which is cool because then it's more empowering.
That's really cool. And I was just wondering, are there little perspective shifts that you've seen that really make a difference in people's lives?
Yeah, so it's so important that that they do have those and that they don't see this as a diet. And I do talk about that with people when they come on and they do like a discovery call or something. I always mention like, this is not a diet. You're not in a caloric deficit, and you're eating less and working out more. Like, it's not that kind of mentality. And so when I had a client, just recently, and she said something that was like, I was just like typing it all out as she was saying it, because I'm like, I need to use this. And she said, I'm coming to realize that this isn't just like a 6-month thing for me. Like, this has to be, and this is a client that I saw before, and she's, come back and still in pretty good shape, all things considered, but she had a couple things come up. And so she wanted to revisit me and just kind of get those under control, had some sugar cravings come back. And she was like, I'm really finding that my mindset has everything to do with this, and that I can't just be like, oh, I'm going on a trip, I need to get on program, and she's like, I need to be on this majority of the time. And then maybe there are some special occasions, but I'm back on after those occasions. And I'm like, yes, that's it. It is. Like, I'm like clapping on the other side of the screen when that happens. So yeah, it's good.
That's huge. Going from dieting
yes
to eating healthy all the time
yes.
and an occasional break.
Right. Because it's really crazy to think of the fact that when you're choosing to eat well, that to everybody else it looks like a diet, right? And so like when you go into these social situations, like, and this is for me all the time, although most people know by now, like with the nature of my job, and I've been living this way for, I don't know, 10 years or so, that, they're like, oh, she's not gonna eat that, she's not gonna drink that, whatever, and they don't bother me with it. But there's a lot of my clients, they'll come back, they're like, yeah, there's, I went to this holiday thing, and everybody's like, oh, just eat one piece. It's not a big deal. Like, what? You're not fat. You don't need it. And I'm like, but it's not about that. Like, it's about the fact that that thing flares up this condition that you have. It's less about the scale and more about the inflammatory response, or, the fact that, okay, well, you have that thing and it tasted good for, 30 seconds a minute, and then now you're paying for it for 72 plus hours after the fact, and so it's having that foresight, to be like, okay, I don't want to, I know what I'm going to feel like after I eat that. It's important. It's a good mind shift to have.
It is. And there's this big misconception, as you were saying, around dieting.
Yes.
Is there any other big misconceptions that people have when it comes to nutrition?
Well, I kind of covered the one, just the fact that, weight loss on its own, there's usually those other underlying things that are going on with that. And then there's a lot with gut health that people don't quite understand. Like even just antibiotic use, we'll use that one because it's so common. You go in, you get your prescription for your 7 to 10 day antibiotic for whatever it is, that you got going on, and people are kind of like, okay, well, moving on. Well, your microbiome is now disrupted for a minimum of 2 years. And that's really hard. That's really hard, because then when you do, like, that's out of your mind, right? You're not thinking about that antibiotic that you took, and it's years later and you're going, man, why do I have all these gut problems like coming out of nowhere? And they're not going to relate those things because they weren't in succession, and so there's this gap, I think, and it's being filled. I do think you might be able to agree on me with that there are more, conventional medicine physicians that are recognizing the importance of gut health. I don't know what to what degree, that looks like, and how exactly they're approaching that. But yeah, I just, it's amazing to me how many times I hear clients. I just had a client who went to her dermatologist. She had a cyst that was kind of recurring. And she's like, yeah, it just keeps coming back. I don't know what to do. And the doctor, she said she just kind of looked at it and went, oh, yeah, okay, you just take an antibiotic for 2 weeks and we'll see if it goes away. And if not, then we'll do something else. And I'm like, no. And she's like, I didn't fill it. So some people are aware. But it's just hard when that's the first the first response, to a lot of the problems people have. So
It's frustrating, but it does seem like the whole world is slowly coming around.
slowly, yes, yes,
Well,
and I'm grateful for that.
Yes. And at this point, the listener might feel a little bit overwhelmed by everything. What do you think would be the first step, an easy step towards changing their nutrition in a positive direction?
I think really the best thing you can do is avoiding boxed processed foods. Just starting to really clean that out of the pantry, relying on whole foods, relying on lean meats, healthy fats. When you do that and you just, it's kind of like a cliche, but shopping the perimeter of the grocery store, and really just focusing on those whole foods. I call them God foods. It's what we've been given here on earth rather than what's been manufactured. And our bodies really respond so well just to that one change of kicking sugar out and really just bringing in all that nourishment.
That's a huge tip. So just
Yeah.
avoid the boxed foods.
Yes.
Girl Scout cookies don't count though, right?
Oh Lord, no, not those. I just saw an article. We might need to talk.
Oh boy. What's coming up for you and Many Paths Nutrition? Do you have anything exciting on the horizon?
Yeah, so I have on February 12th, I have an 8-week slim down kicking off. And so it's geared towards weight loss, but anybody can really join because like you just said, what's the biggest tip? It's whole foods. It's whole foods. There is a fitness, kind of calendar that I give out as well that has some really good workouts in there that are all, it kind of caters to the middle, but they're weightless. So it's just using your own body weight and you're doing upper body, lower body. Yoga is put into that. There's some meditation that's put into that. So it's very body, mind, soul, kind of a thing. So it's not, it's called a slim down. It's really just a health tune-up, I like to call it. But yeah, I have that coming up on February 12th and everything is virtual. So it's really nice. I just send everything out. And then in that, I'll be doing 4 webinars that will include like going over adrenal health, talking about the grocery store. I do a grocery store tour as a part of my program with all of my private clients, but then in a group setting, I'll be doing this as a webinar for everybody to talk about how to grocery shop and how to kind of demystify the experience because they've gotten very clever with their packaging and their terms and their marketing and the labels and everything. And sometimes I can be fooled, if I'm not careful. And then I get home and I'm like, I flip it over. I'm like, ah. So yeah, it's hard to keep up with all of it. But yeah, that's a part of it, a component of it. I talk about gut health in that as well. One of the webinars is on gut health. So, and then I think one of them will be the 5 pillars of health, which go over the food you eat, the water you drink, your sleep, your exercise, your stress, and basically like 5 main tips within each of those that you can implement easily. So it's a lot. It's a lot of information. It's a good, good program and very well-rounded, in my opinion, for somebody who really wants to like kick off 2025 in a big way and just get their health on track.
Sounds like a really great resource for people.
Yeah.
So make sure you check it out.
Please do.
But that's got me curious. Are there any fears that people have that stop them from working with you?
I think the biggest hang up that a lot of people have is the lack of being able to use insurance. A lot of people struggle with that because they pay a lot of money for insurance. So I get it. And I'm victim to that as well sometimes. But the problem is a lot of times there can be limitations with going through insurance, as you know. And so when those limitations come up, they don't get as good of care. And so when I'm cash-based, I have more freedom, and I have the freedom to, if you are really going through something and you need more of a therapist at that appointment, then guess what? We have some extra time, to be able to focus on that for you. And it's so custom in that it's really driven, the appointment's driven by the client and what their needs are, rather than, okay, we have to stick to this time frame and, all these things, and I have these restrictions and whatnot. So it makes it so much more valuable for the patient. And I think that's one of the things that hangs them up, is cost a lot of the times. But for me, your health is so priceless that you don't realize until you start to lose it or have lost it that you would give any amount of money, and so that's been the case sometimes, that it's people are really at the end of their rope with they've hit every dead end with conventional medicine, and so I'm like a last resort, kind of a thing. And I'm like, man, I wish we could go back like a year or two to when this was beginning, and we could work together, because we would have been able to make so much more progress, and going backwards is harder. We can still get there, but it's an uphill battle a lot of the times when that inflammation is so bad.
That's so true. So many of us wait until it's really impacting our lives, instead of just pausing and loving ourselves now, caring for ourselves now. Right.
And just knowing that you're worth that cost. Because a lot of people, that's the problem, is sometimes they just don't feel, I can't spend that amount of money on me. It doesn't even matter how much it is. It could be $20, and they're like, oh yeah, no, I can't spend that on me. But you're worth it. You're worth it, and your health is worth it. And it's such an unselfish thing, because the ripple effect of feeling healthy is impacted in your job, it's impacted in your family and your relationships, your parenting, your marriage. I mean, it just trickles down into everything. When you feel poorly, you're going to behave poorly or just not be in your right mindset. So you're more your best when you're healthy. So for me, it's just priceless.
It's been really great having you on and helping break down some of these fears and the misconceptions around nutrition.
Yeah.
I always ask people, do you have a message or a mantra that's really important to you that you'd like to leave people with?
A message or a mantra to leave people with? Well, I'll just kind of echo what I just said. You are worth it. You are worth it. Your family is worth it to be able to have the best version of you. It's so important to stay ahead of our health, because when it does get too far gone, it's hard to see. It's hard to see 20 years down the road. But the decisions that you're making now, the choices that you're making with your food and your health now is going to reflect, 10, 20 years from now, maybe not even that long. And so it's so important to be focusing on those things and have that foresight in mind.
Thank you. I hope you enjoyed this episode of the Huron Valley Now podcast. Make sure you hit the like, subscribe, and check out Britt at Many Paths Nutrition.
Thanks for having me, John.
This episode was sponsored by the Rho Tribe Chiropractic.
When you're ready to embrace a healthier perspective tailored to your needs, discover a world of wellness with the Rho Tribe.
Everybody say, bring not bone alone. Come on, bring not bone alone.
At the Rho Tribe, we specialize in easing daily pains and discomforts at our House of Wellness, where we focus on what truly works for you.
Everybody say, bring not bone, hey, bring not bone alone. Everybody say, bring not bone alone. Yeah.
Experience the difference at Rho Tribe Chiropractic and Wellness in Highland. Call or text at 248-800-6214